Hi everyone, I hope you're all doing well on this beautiful Monday. If you hear any small children in the background, they are mine. They get so loud, it's unreal sometimes, so I do apologize, but I'm going to be going over our case study with you on this video. So what I want you to make sure you're doing, many of you have printed this off already. We were going to be working on it in class and you had a hard copy of it, and I still want you to make sure that you're going through that and reading through everything in detail so that you understand it. But here is access to it online. You will be able to click on the syllabus and then of course go to the major assignments, scroll down, and you'll click on the case study. And after you click on the case study, you'll be able to see that you're completing it on one individual. Hopefully you have someone in your home who you are quarantining with, and you can assess them for your case study. You're going to be completely filling out the assessment materials, as well as developing a 4-week exercise prescription for them. So if you click on this, you'll be able to find the entire template. It's 11 pages. You'll be working through this to complete and making sure that you're filling out everything. The big area of where people lose points or students lose points that I see is they really skip over some small details like dates. Make sure that you are filling out every signature, that you're filling out the names correctly of your participant, and then you're the witness. So make sure that you have your participant's name, your name, and dating both of those. You'll have them fill out the PAR-Q, answering these questions appropriately. And remember, this is a great screening if you're looking at someone who wants to become more physically active. This kind of shows us some warning signs that they need to go see a physician before they become physically active. You'll scroll down here, making sure that you do put their name, their signature. If you're assessing a minor, make sure that they are filling this out. So the parent is signing it. Make sure date and you are the witness. You'll then scroll down. This is our health status questionnaire. This is what we did at the very beginning of the semester, where you were completing the health status questionnaire. You will fill out the personal emergency contact information. You do not have to put their address, but you do need to put an email address here. So again, I don't have to have their personal address, but make sure you are filling out their name. Give me an email address. Make sure you're filling out their date of birth. We need to know their height, their weight, their physician's name. You can be their person for in case of emergency. Again, if you were doing intake forms at a doctor's office, if you want to become a nurse, if you want to become a physical therapist, an occupational therapist, all of this information would be in the intake process when you are assessing a client or patient. Make sure that they fill out the general medical history completely. Remember this, if they are checking one of any of these boxes, they are considered high risk. So if you are assessing your father who's had heart surgery, he goes into a high risk category that he would need a physician's clearance before he begins physical activity. Make sure that you are looking through all of these, that you are reading through this appropriately, and making sure that you're paying attention to details. Remember that our section 3, the risk factor assessment, you are looking here. If they have 2 or more, they are moderate risk. Remember, just because you check like 4 or 5 of these does not put them in a high risk category. You need to pay attention to these because it should influence your exercise prescription, especially if they have not been physically active before, if they have a larger waist circumference. You need to pay attention to these details because, again, it's all information to influence the way that you prescribe exercise for them. Are you taking any medications? It's really important to know this because certain medications can change the way a person's body physiologically responds to exercise. So you need to make sure that you know what types of medications they are on, and if there are any, if their physician has told them any certain things that they are or are not supposed to do. Make sure you fill out this completely. And then, of course, our FIT principle. Remember our frequency, our type, our frequency, our intensity, and our time. So if they are doing, if they walk every single day, again, that's some moderate physical activity. How long do they walk? You want to make sure that you get a clear picture on what it looks like in a day in their life or a week in their life. How often do you do this? Do they exercise once a month? Do they never exercise? It's very important to make sure that you are classifying all of this so that you get a picture of what it looks like for them for exercise. And if they have any barriers for exercise, I usually always say, what's your exercise story? Tell me a little bit about what you've done previously. What did you like doing? What do you not like doing? Make sure that that you are writing down their specific goals for their exercise program. So you can also see that you will be you'll be signing here, they will be signing here, and you will be signing. You also this is where another area that I see a lot of people miss points. You need to give them a risk stratification. Are they low, moderate, or high? We did this in our first assessment, our skills check 1 assessment. And do they need to see a physician? Yes or no? So make sure you are looking back in your notes for those. This brings us to, I believe, page 7 of our assessment. And you are going to want to fill this out completely as well. Participant name, gender, age, height. Make sure you're paying attention to inches and centimeters, and that you're paying attention to pounds and kilograms. Remember, our pounds are divided by 2.2 to get our kilograms. We had that on our exam. You will also make sure you take their resting heart rate and their blood pressure, both from skills check 1. Predicted max heart rate, which is 220 minus their age. And then you are going to be assessing their submax for 85% of their submax heart rate. 85% of their submax heart rate, which is 220 minus their age. Make sure you are writing their SMART goals out: specific, measurable, attainable, realistic, and time-bound. That time-bound should absolutely be a focal point, but I do want you to make sure you're adhering to the SMART goals. Time-bound, you give me a specific date. When do they want to accomplish their goal by? As far as muscular fitness and flexibility, I will be providing additional resources for these, as well as a short video describing how to complete these. We have assessed cardiorespiratory testing, our estimated VO2 max. So remember, we looked at their aerobic capacity, our VO2 max, and we did that with the Rockport walk test. So you're recording their time, their heart rate, and then you're going to complete the calculation as well as where they rank. And all of that information has been provided for you on eCourseware, as well as in our classroom discussions. So you were able to practice that along the way. As far as body composition, we're going to look at BMI, which is a ratio of height and weight. And you're also going to be classifying them into either normal, obese type 2, obese 2, and you'll have some people who are underweight for their height. So you may have somebody who falls in the under category as well. So you'll want to make sure with BMI, you can actually use an online calculator, but make sure you're paying attention to if it's being recorded, being estimated using feet or inches, and also as well as kilograms or pounds. You'll then complete the waist and hip measurements as well as the ratio, adhering to the protocol that we've practiced in class, and making sure that you are classifying them after you calculate the ratio. As for the skin fold assessment, you're going to be recording their weight, and then you're going to be using either male or female. Please make sure you do not do both of these. So let's pretend you're going to be taking measurements on your father. You take site, chest, abdominal, thigh, and then you take those 3 sites again: chest, abdominal, thigh. I kept seeing people take a chest measurement twice. You want to give the skin time to rebound. It has an elasticity to it, and you want to make sure that it has time to rebound. Give them a break at that site as well. And then you're going to be averaging both of those sites. So if you get, let's say you get 10 and 11, it's 10.5 for the average. So make sure that you're paying attention to this. You're averaging, you are adding all 3 sites together. So if you had 10, 10, and 10, you would have 30 right here. And then you would look on the chart for where they fall in terms of their skin fold percentage of body fat. Make sure that you are paying attention for the recommendations on where they fall. This leads us to our exercise programming, our activity prescription. You're going to look at You're going to write their name, their age, gender, training zone. I will be uploading the heart rate reserve calculation and how to calculate this. You will write their goals again in terms of, we will be looking at cardiorespiratory, we will be looking at musculoskeletal, muscular fitness, as well as flexibility. I want you to make sure you're writing down their specific considerations as this, and use those to guide you as you write their program, making sure that you're including that warm-up, the flexibility component in the dynamic warm-up. Remember the flexibility movements that we've practiced, that we've talked about in class. Remember, you're not performing static stretches during the warm-up and during that dynamic warm-up flexibility portion. We go then to cardiorespiratory, the body of the workout, the body of the cardiorespiratory workout. Remember, this is the component where I discussed that it's very important to include what they want to do, what they enjoy doing, what they have access to doing. If you prescribe swimming and they have no access to a swimming pool, that's not what's in their best interest. Make sure that you're paying attention to those. You'll also write duration and frequency. How many days a week are they doing this? How long, their duration, how long are they doing this? How many days a week? You're also going to be looking at the intensity portion. I will be going over this in the heart rate reserve video, the calculation for heart rate reserve, so you'll be seeing that here shortly. You can also see the Borg's rate of perceived exertion. Many times we usually refer to this in group fitness as from 1 to 10, 1 being lying on the couch expending hardly any energy, to 10 being as hard as you got, as long as you've got. Very, very hard, very vigorous. So again, you can see here it has very light at 8 to all the way at 20, and they modified the board chart to 1 to 10. Make sure that you're providing a cool down. Remember, you need to return the heart rate to normal or resting, walking around, and then you need to provide those static stretches. You can then click on to Muscular Fitness. You'll be able to see what type of activity. I uploaded the video for this particular section in last week, where you were able to see how to create a workout. For the purpose of this class and this assignment, you're going to be writing a lower body exercise, an upper body exercise, and then a core exercise. And you'll be repeating that for at least 8 to 12 exercises. So make sure that you are paying attention to that and including that, because this will be the best way for you to provide a safe and effective workout for a population just needing to maintain muscular health and fitness. You'll also want to pay attention to body weight, machine weight, and free weight, and any other materials and equipment that they will be using. You will list the exercises here. You'll type those exercises as well as provide the load. The load here is body weight. It may also be dumbbell weight. How much weight are you wanting them to lift? How much weight are you wanting them to bench press or chest press? How many repetitions? How many sets? What is the frequency? How many days a week will they be completing this workout? Then we'll go into the flexibility portion after they complete their muscular fitness. Make sure you are including that in the flexibility, that you are providing detailed instructions of what you want them to do. As far as the exercise programming, you will be writing your schedule. For example, if you want them to complete cardio on Sunday, they have a rest day on Monday, and then they complete their musculoskeletal, muscular fitness on Tuesday, and then they have a rest day on Wednesday. You need to write out their schedule, their training effort, and their duration. Any other comments that you need over here. You will progress them from week 1, 2, 3, and 4. I should see a progression. That is my big focus here. How are they progressing? And then, of course, you're going to summarize all of their information as well as their activity recommendations right here. Please email me with any questions. Thanks.